Welcome to the art of patient communication. Have you ever met a patient who seems completely irrational, or a staff member who suddenly becomes emotional over something small? Or have you find yourself snapping at your spouse, your children, your team, and later wondered, why did I react like that? Today we are talking about something that completely changed the way I view people. It's called the window of tolerance. And once you understand it, you will stop asking what's wrong with this person and start asking what happened to this person. Let's talk it out with Dr. Jimmi Patel today. Hello, Jimmy. Welcome back to episode 8.
Hi, Kritika. Thank you for having me again.
So today I want to ask you, have you ever met a very difficult patient who has been irrational or a team member who just got very emotional at nothing?
All the time.
Yeah.
Almost daily occurrence.
Daily, yeah.
Jokes apart. Yes, it happens.
Yeah.
Of course.
Yeah.
Most of the time we just call it's life,
Yeah.
and we
And
move on.
Yeah.
So it happens all the time.
Yeah. So I actually come across something to answer that question. So why have they behaved in that way, or why a good patient suddenly becomes difficult, right?
Or a behavior is completely different than what you normally expect them to be.
That's right.
Yeah.
So there's a concept, a psychological concept developed by a psychologist, Dr. Dan Siegel.
Okay.
It's called window of tolerance, right? So this window of tolerance means that most of us operate in 3 zones, okay?
Mm-hmm.
The middle zone is called the window of tolerance, which is the normal zone, which is where we reason, we listen, we talk, we problem solve.
Like medium energy.
Yeah, exactly. Not too much, not too less.
Yeah.
Yep. And we regulate ourselves like very normally there, and and we are more reasonable, right?
Yes.
Then the other zone, which stays above that, is called the zone of hyper arousal, which is where we are in fight or fright response, right?
Okay.
In that we get angry, we are stressed, we are yelling, or you could be having a panic attack or something like that, right?
Yeah. So.
And then the third part of that is the hypo arousal.
So it's below.
It's below, correct.
Yep.
Below the window of tolerance, yes.
Okay, yep.
And this is like freeze, where you just don't say anything. You're quiet, you're in shock. Absolutely nothing.
Basically.
Disconnected. You've checked out. You're gone.
Yep.
You're still there in the room, but you're not connecting.
Yep.
Right? And they are the 3 zones that we normally are. And then there are some people, who've had some experiences or busy lives or whatever, and then they have made their hyper arousal aroused zone way bigger. So they pretty much function out of that. That's how they are.
So that's how they operate most of the time.
Correct. Like high adrenaline, like always up there, right?
Like our boys sometimes, they're just super energetic for too long.
That's it. That's it. Exactly that. Right? And then there are others who are just they just don't say anything.
For too long,
right? Yeah, they're just, right? So, and normally all of us kind of regulate out of those 3 zones.
But here we're not talking about just the energy though here.
As in?
So you know how you're saying that there is hyper arousal?
No, it's not energy. It's emotions.
It's the emotional management,
and which comes through their behaviors, right?
Yes.
Yeah. So if I take you back to season 2, the lady who had come to see one of my associates, she was quite abusive. She got quite upset in the room when the treatment was denied. And when I put her on the window of tolerance, how do you think now we can link that up?
So just from memory, I think she was quite aggressive.
Yeah.
Well, not aggressive, but her behavior was quite aggressive.
Yes. Yeah. She was abusive and quite upset.
Okay.
Yeah.
Is it hyper?
So she was in hyper because if you now look at it from that perspective, she had a lot going on in her life.
Yes, that we figured out later on.
Yeah,
yes.
like, she didn't sleep the night before. She had medical appointments. She was diagnosed with cervical cancer. She had treatment on Monday. And all of that had actually thrown her out of her window of tolerance, and she was now behaving out of the stage number 1 or the one above.
So just a question. So let's say there's person B who had the same problems in their life. Could they have acted in hypo? So it's not like if you your life, if you have certain experiences that automatically triggers you to react hyper. No, it's more subjective than that.
I think that like I'm not a psychologist, but I think or a psychiatrist, I think yes, everyone would react differently.
So
like some people freeze and others
will go on the top layer.
That's right. Yeah.
That's good.
Yeah. So I think reflecting back, like it just, I think what has really changed my thinking is that we need to be more mindful of the patients, that right now this is not them being normal. They have been thrown out of that window of tolerance where they can reason with us.
So sometimes we talk about that when someone is in extreme pain, they sort of behave out of their character. So essentially that's what you are putting it in more professional way, that why is that?
That's
so they're just basically reacting out of their comfort zone.
Correct.
Or behaving out of their comfort zone because emotionally they are overcharged.
And there are layers to their behavior. They are not just angry because you have just given them a bill. They're probably angry because you were running late. They have an appointment they need to get to.
Correct.
And now you've given them a bill and that they've just tipped off.
Correct.
So so that was the last strike that had to be done to throw them out.
For them to, Okay. Interesting. Yeah.
And I think the other thing that I really want to know is that what about the other way around? What about the clinicians going through that? What's your take on that? And I think, like I want to know because...
interesting.
Yeah.
So I suppose at the end of the day, we are talking about human behaviors and human emotions. So from that point of view, if it's impacting our patients, it's obviously impacting us as well. So it can happen to us as well. And from that point of view, I remember so many times I have conversations with our associate that, don't get... So I forgot the saying. They say that the news is not as bad as you may think, and it's not as good as you may think. So it's pretty much that line to me tells me that don't overreact to something, or don't sort of don't get too happy or don't get too sad. Just try to maintain that healthy behavioral or emotional balance. So that's the advice that I give to our associate all the time, that, if you do something really well, don't get carried away and think that, I've conquered dentistry. Or if something goes, pear-shaped, or where something just went wrong, don't think that you are a bad dentist and you are not made for this. So you just have to
This is how we normally go, isn't it?
Yes,
it's one
that's
extreme
right.
to the other. Yeah.
From the clinician's point of view, I think this whole window of tolerance explained it really well, that as clinicians, we go through the same emotions, and it is extremely important to be aware of these things or this particular model, that, where am I? And it's good to have a little check every now and then during the day, that, where am I sitting here? And how am I sort of responding to my internal emotions? And am I coming across above the tolerance window or below the tolerance window? And then we can recalibrate. I think awareness is the most important piece.
Absolutely. And then, they say the rest of it, like sleeping, good diet, and maybe Pilates, meditation, gym, whatever. Like
I think the mental health can only function if physical health is looked after, I suppose.
That's right.
So,
so
it's very
that
easy.
kind of helps you to expand that window of tolerance. Yeah.
So does it mean that, so I'm trying to visualize it in my head. There are 3 bands.
Yeah.
Do you want to have a pretty large middle band?
Yeah.
Is that what you mean?
Yeah, you want
Is that the aim of it?
Yeah, that is the aim. The aim is that the window of tolerance, that should be quite wide. So you should know how to regulate yourself and communicate at that normal level. And then, so moving out or jumping out of window of tolerance is not a wrong thing. It's a very human thing.
It's going to happen.
It's going to happen. But going there and then coming back to the window of tolerance as fast as you can healthily.
So that's a good thing.
That's a good thing. So that's the thing. Like when we, as a clinician, we sometimes get into a rut, right? We go through a bad clinical scenario or a difficult patient management, and then we mull that over until it becomes part of our DNA.
Yep.
And I think that's what like sometimes it makes me think like, how do you like just get up and move on from that?
That begs the question then, is there a lost opportunity here? So let's say I've got a clinician whose window of tolerance is pretty big.
Yeah, okay? Like a calm person.
Yeah.
Yeah.
He or she makes a mistake.
Yeah.
Bring them back to normal window, they just move on.
Yeah.
Too quickly.
Yeah. I would see that as a problem.
That's right. So where is the line here, right? So they make another mistake.
I would be like, oh no, they haven't
they
really.
move on very quickly.
Yeah.
So, or someone who, on the other side of it, which is we've achieved something really amazing.
Yeah.
And then they come down very quickly in terms of, not in a negative sense, but they just brush it aside and then
don't
they don't celebrate it. So is there a downside to this, I suppose?
I think it's,
or maybe we don't understand this really well.
Look, I just think that there's no advantages, disadvantages. I think what I'm saying, I think all this concept is saying is that first of all, when you are dealing with your patients, to recognize that, that they are not personally upset with you, right?
Yes.
Recognizing that they are going through a phase, or they are in that zone right now where they could be upset because of something, and it's not against you, right? Because normally we take it personally. We think, oh, they don't like me, or they were very rude to me, or we make it all about ourselves.
Yeah, it's not a person, it's just a behavior.
It's just a behavior. So it's just, and they could have lots happening in their life, and hence why they have behaved that way. I think that's one thing that we need to remember. The second thing is that as a clinician, we need to remember that sometimes if we are not in the window of tolerance, if we are hyper or hypo, and you come across a patient who is also in one of those zones.
Oh, yeah. Big problem.
Big problem.
That's correct.
Right? And I think, and that's what I remember the wise words of Dr. Appa. He said the same thing, that if I am not going through a very good patch in my life, and if I meet a patient who's not going through a very patch of life.
Very good patch of their life,
you need to walk away. You need to be able to recognize that moment.
Yeah.
That I am not the right provider to provide them a particular services. Because I feel like, when patients are hypo or they're hyper stressed, they come and sometimes they ask for
big treatments.
Yeah, they do, because they are looking for that dopamine.
Quick fix.
Yeah, and they want to feel good. They think that I will get
about their life.
Yeah, and they want to get these 10 veneers, and they want to feel
so many names coming to mind.
Yeah. And I feel like that's the thing you want to recognize.
Dig deep a little.
Yeah, and go, you know what? Let's take some time here and come back to this conversation. Maybe you need another pair of eyes, another clinician.
Not
you get them in
too much.
Yeah. So I think that's all what it's talking about. Like two things: recognizing when you are in that phase, recognizing when the patient is in that phase, and and just having the awareness to kick back into normality. But obviously, the one that you said, that if you've made an error and if you've just moved on too quickly from that, I wouldn't do that.
That's right.
I wouldn't get upset. Like I would get upset for a little bit. That would be my approach. You'll go down a bit, but then you'll find the solution to it, and then you can move on.
Correct.
Yeah, because you don't want to leave a question unanswered. Yeah.
So would you say that, let's say you come across, as we touched on it earlier, that if someone has either hyper or hypo window too far stretched, and they only operate out of that particular zone most of the time, what's your, how do you manage them as a clinician? So where you are dealing with someone who is in layman's term difficult.
Yeah.
Okay. How do you then you recognize them that they're acting outside of their window of tolerance, but then you don't expect them to be different anytime soon,
Yeah.
how do you then operate
Yeah.
or deal with
I
those
feel
patients?
like this term, obviously this structure, I've only been introduced to it.
So yeah, we want to be very clear to our listeners that we are not experts here.
No,
we are only talking
no.
about this
That
because
we've just come across
we
it.
see
Yeah.
some
And I
similarities
think
here.
in 2 weeks ago, I've only been introduced to this like literally
Correct.
2 weeks ago, right? So, but before that, if I had a patient who was I would classify them as a high flyer.
Yeah.
Right. When they come into the room, I just know that I try to match their energy.
Yeah.
Like, if they want quick answers, fast answers, they are rushed, and however they would like to take the appointment, I tell them that. And people like that, I just tell them what to expect. Like I would treat any other patient, Jimmy, except that, as I said, I would just match their energy pretty much. Like not be a high flyer, but just be fast paced. If they like me to take the appointment fast, I would answer them their questions.
So you're just
that way.
basically trying to be accommodative as best as you can.
That's it. Yeah. Being reasonable. I would still be reasonable. And if I think that I am not the right clinician to treat them, I refer them to you.
Yeah, thanks. Okay, yeah, that makes sense. So basically just understanding and getting the read on it is the most important step in the whole thing.
That's right.
Okay.
I think so. Yeah.
So this is a fascinating topic. And you just said that you just been introduced 2 weeks ago about this whole thing. Would you mind sharing your experience, how you got to know about this? Because I think, some of our listeners will really sort of get some insight out of this. Yeah.
Yeah. So obviously, like in the last 2 years, Jimmy, like we have, as you know, we've delegated a lot of our business responsibilities to the right professionals.
Yeah.
And that has given me more time and space to think about what I am doing, right?
Correct.
And then more so in the last 6 months, our boys have gone to the boarding school as well. So I have even more time, right?
And I think we can clearly say that our whole life has
turned upside down.
Because we've changed locations and everything.
Yeah. And I think in the last 6 months, what I was feeling was that Monday to Friday, when I'm at business, I'm not as stimulated in the head like I have been since 2012 till 2024, right? And then slowly we have delegated things, right? So they've gone one by one. And I think in the last 6 months, what I have been feeling is that Monday to Friday, I'm like, go, because I'm working, seeing patients, doing, my little projects at work. And then I'm feeling like up here, which is what I think I now can see. I was hyper aroused, right up there. So problem solving and, feeling that, I've got this. And then come the weekend, if I have nothing to do, if I'm just staying at home, just quiet, I would completely go from top to the last stage, which is hypo. So almost feeling sad, depressed, just quiet, nothing.
Like a lot of people just say that I wouldn't know what to do with myself.
That's right. Like I just and I just feel low, right?
Yeah.
So, and then I started getting these headaches as well, like they just wouldn't go away. So on someone's recommendation, I thought, right, I'll see this naturopath. And so I ended up seeing her online. She's based in Davos. So I saw her and she explained me this window of tolerance. And she's the one who said, when I was explaining her like how I feel, and I think my main question to her was that I don't understand, what am I sad about? Like, I just don't know. Like, touch wood, like, we've got 2 good, successful businesses running. I can do what I want. I take 2 days off work. I don't work Monday, Friday. I work Tuesday to Thursday, and I can do what I want. I've got everybody's happy. What am I sad about? And why do I feel this way?
Yeah.
And then she obviously went on asking me how my life has been, what I've been doing. And I think while I was talking to her, I realized on reflection, like since 2001, our life has been go.
Yep,
busy. 2001 to 2006, you do dentistry. Then we started studying for Australian qualification examination. We did them. And then we were like, next thing, we
want to own the business.
We want to buy the business. Then next thing we had the boys. And then once you have a business, then you are problem solving,
Expanding the
bookkeeping,
business,
marketing, and HR, and all of a sudden you get all these things thrown at you, and you're juggling so many balls, right? And I think my brain is just so used to that adrenaline. It just wanted that. It was feeding off that.
Mhm.
And even on the weekends, I'll try to find something that'll keep me up
Keeps you
there,
going. Yep.
right? And so I'm just know how to live in there. And she said that your window of tolerance is actually very narrow. Like you pretty much you jump the window of tolerance, so you don't have a like calm,
The calm,
calm
the
zone.
middle energy is not there.
Not there. She's like,
It's
you go
either
from
too much
or too less.
too low.
Mm.
So the excitement is either too much or too low.
Yeah.
There's nothing in between.
And I think since like I have even thought about like I've got all these people doing these other jobs for me. Obviously, I'm not qualified to do them, but I was doing them. And I'm thinking, oh, is that the problem? Maybe I need to get them all back and, maybe need to
make yourself more busy again.
Yeah, that's right. But obviously it's not healthy because it's not good for you because a headache and all of that.
Would you say though any ambitious person, as I always say, we both are ambitious, would be same as you? Like they just don't know how to stay in the middle zone?
Maybe they don't. Maybe they say, like she was saying that like most of the high achievers, they are like that. But I feel like that, like after discussing with her, I think that I was doing jobs that needed a lot more effort. So that doing them is actually keeping me from doing what might come from me at a very less effort. And I may be bloody fantastic at it, right? Whereas I have been spending all these more energy and more like ATP on stuff that I am not naturally wired to do.
Correct.
Like I hated every minute of bookkeeping. I hated every minute of trying to do the marketing and now that I don't have it, I don't even look at it because it's not that comes naturally to me.
Okay.
And if anything, I've been spending more time in the things that I like or want to explore that what I enjoy doing to widen my window of tolerance.
So just to overlap two things, what you just said in terms of after giving away some of the things that you were not doing them easily, they were more stressful. And what you and I have been feeling in last sort of 18 months to sort of 12 to 18 months, would you say that by staying in the window of tolerance, your clarity is better,
Absolutely.
Your decision-making quality is better, like you make better decisions and you think clearly?
Yeah.
Would you say that?
I think, obviously, again, my awareness is only 2 weeks old. So I think I can recognize though. I think I can recognize and I can tell you that what can throw me out of it now. I literally see that those three zones in front of my eyes all the time.
Yeah.
And I know when I am about to get thrown out of it.
Yeah.
And now I can recognize that and say, I need to come back to being normal.
The ability to
and I think that is a amazing tool for any one of us because we constantly go in and out, like, as a business owner, as a clinician.
Correct.
Constantly. And you have to maintain your sanity by coming back in it or even recognizing other people when they are not in it.
It's good to challenge yourself every now and then, but then you, as you said, the ability is the big word here.
Absolutely.
So we all go up or down.
Yeah.
But it's the ability to bring ourselves back to.
And it's not abnormal to go in and out.
Of course,
because we are humans, right? Yeah.
That's right.
But the ability, yes.
To bring back
to come
where
back
we need
into
to
that.
be. Yeah.
Yeah, that's right.
Correct.
Thank you for listening. I hope you got something out of it. Do not forget to subscribe to my YouTube channel and follow me on Instagram. Bye.